What can people do to say, all right, this is the moment that I need to go see my general physician?
Sure. Well, first thing, people need to understand there's a difference between stress and anxiety. Stress is what the world throws at you. Anxiety is how you respond to it, and they're not always proportional. You can have maximum stress and no anxiety, or not a lot of stress but feel very anxious about it. So there's sort of a disconnect between actual stress and anxiety. They can be proportional, but they're not always. And I think there's a point when it's starting to affect your health and you are in this hypervigilant state. You can't focus on your work. It's affecting relationships with your loved ones and your friends. That's when you start to seek help. And a good place to start is with your internist, because at least he can start you along he or she can start you along the path towards maybe talking to a therapist, maybe getting you to somebody who can provide you with help, and maybe even starting you on a medication. That's not our first response. We don't always throw drugs at people, but it's a place to start to at least begin to address the problem. And another great thing, one of the best stress relievers there is exercise. Exercise produces an endorphin rush. The chemicals of the endorphin rush hit the same receptors as a lot of the drugs that we prescribe. So that's a great place to start. Get out and go for a walk. Get to the gym, because truthfully, that's my drug. I work out almost every day, and I don't do it to stay in shape. I do it more as a therapy.
Yes, right. Well, if your mind can affect your body, that seems like that's sort of reversing it in a good way, having your body affect your mind in a very positive way.
Very true, Tim.
Right. Dr. Frank, thank you so much for taking the time to join us to talk about stress. It's certainly a problem we are all dealing with. Thank you.